Now let me introduce Part 5, Development and Application of Molecular Imaging. Metabolic imaging is the most mature technology in molecular nuclear medicine and has been widely used in clinical diagnosis. They use F18-FDG. Professor Wagner named this FDG molecule of the central molecule. Widely applied in nuclear medicine image in clinic. Nuclear medicine image mainly used for following area. First, research of neurology. With the aging of society, the research of neurology is more important and practical. Neuronuclear medicine is an important branch of neurology. Parkinson's disease, depression, Alzheimer's disease, and so on. And all major diseases that are serious threat to human health and affect quality of life. Nuclear medicine imaging technology can be used to conduct basic research to this disease, such as physiology, pathology. It can also establish a better clinical diagnosis and treatment technology and method, greatly improves the level of clinical diagnosis and treatment of this disease. Because of the resolution of a nuclear medicine imaging instrument is lower than CT and MR in nervous disease. CT and MR have obvious advantage in the morphology imaging of nervous system image. However, since the advent of brain perfusion imaging, nuclear medicine has been demonstrated its superiority in brain function imaging and in the diagnosis of the function disease of the nervous system and attracted attention of clinicians. Tetratherm-99M ECD, a new national drug, has been widely used in the diagnosis of epilepsy and cerebral blood flow disorder. Neurological, psychiatric, and brain function studies, cortical metabolism in different physical stimulation of thinking states, and brain behavior studies has been detected by the new nuclear medicine imaging. F18-FPFLT is a neuronuclear probe for dopamine transporter impact detection, which shows advantage of positron imaging. With the development of neuronuclear medicine, receptor imaging will be more and more useful in clinical diagnosis and treatment for the nervous system disease. Also, the second area is nuclear molecular imaging in oncology. The rise of nuclear molecular imaging in oncology nuclear medicine is considered to be the most crucial high technique in oncology result. It fully demonstrates interactivity and creativity of nuclear medicine, nuclear pharmacy, nuclear biology, nuclear physics, radiochemistry, nuclear electric, and nuclear engineering are all indispensable techniques in oncology research, and its research result can quickly enter the basic and clinical branch of the medicine. Detection of multi-drug resistance is achievable by tetratherm-99M CEA monoclonal antibody, tetratherm-99M small cell cancer monoclonal antibody, and tetratherm-99M MIB are often used. So, nuclear medicine imaging oncology is often used for tumor early diagnosis, staging, recurrence, metastasis, efficiency to evaluate in this area. The third, cardiovascular nuclear medicine. Nuclear medicine imaging has become an important means for the diagnosis and treatment of cardiovascular disease, especially tetratherm-99M MIB radionuclide for the myocardial perfusion imaging. A new drug developed has become a non-invasive technique widely used in the evaluation of coronary heart disease, which greatly promotes development of cardiovascular nuclear medicine in China. Exhibition PET used F18 labeled fatty acid to detect the molecular process of the fatty acid metabolism in cardiomyocyte. Myocardial activity to differentiate myocardial neurosis from hyponating myocardium and provided a basis for revascularization therapy of coronary heart disease is a golden standard for judging the activity of myocardial cells. At present, a spatial resolution of the SPECT and PET is relatively low, so it is possible to detect some small myocardial lesion. Some studies are still trying to explore a new detection device to promote the diagnostic level of cardiovascular nuclear medicine. The most advancing area of the nuclear medicine molecular imaging is as following. The first is receptor imaging. Receptor nuclear medicine is based on the principle that radionuclide labeled ligand binding to specific receptors with a high affinity in target tissue to display the spatial distribution, density, and affinity of receptors. It's a non-invasive functional image method with a high specificity of ligand receptors and high sensitivity of radionuclide tracing technology. Receptor imaging with a radionuclide labeled specific ligand opens up a quantitative window to objectively understand disease and provided an accurate and quantitative evaluation index for observing process of biological change information transmission between human cells and cells in the living body. And second is gene imaging. Gene imaging using a radionuclide labeled material, we call probe, to display the functional dynamic of genes and their expression product as a level of DNA, RNA, or protein without trauma for medical research. There are many methods for gene imaging, such as reporter gene imaging. Since PET reporter gene imaging does not require the development of probe to the specific protein for each new gene study, it has become a common imaging method. The third, radioimmunoimaging. This technique labeled antibody to define the antigen expressed on the cell. The technique programs are producing human anti-murine antibody and also large molecular weight, slow clearance from the blood, low T target to non-targeted ratio, and poor penetration ability. So the future to develop the fragments of antibody and a single chain antibody, and also for the hypervariable region peptide. The last one, apoptosis imaging. Apoptosis imaging is very useful for the disease diagnosis and for therapeutic method selection. The abnormal expression of phosphatidylserine on the cell membrane is a target substance for apoptosis monitoring. So we can use tetragerm-99M to label annexin 5 to do the apoptosis image. As we talk about today, major imaging technologies showed in this picture: CT, ultrasound imaging, magnetic resonance imaging, MRI, nuclear medicine imaging, NMR, and optic imaging, we call OI, and considering of anatomy, physiology, and molecular level for molecular imaging, the best imaging for molecular level is PET imaging. Okay, that's all for this part. Thank you.